Welcome to today's video. And what if I told you that for many people with type 2 diabetes, there's a path that could potentially lead not just to better management, but to remission? That's right, not just controlling blood sugar, but reversing the progression of this life-altering condition. Today we're diving deep into the science-backed strategies that are helping thousands of people regain control of their health and, in many cases, dramatically reduce or even eliminate their dependence on diabetes medications. Whether you've just received a diagnosis, have been managing type 2 diabetes for years, or are supporting a loved one, this video is packed with insights that can truly change lives. But first, an important disclaimer: this video is for educational purposes only. It is not a replacement for personalized medical advice. Always consult your healthcare provider before making any changes to your treatment plan. Every body is different, and what works for one person may not work the same for another. That said, let's take a hopeful, practical, and scientifically grounded look at how type 2 diabetes can be reversed. Section 1. Understanding diabetes reversal. Let's start with what reversal or remission actually means. In type 2 diabetes, remission is generally defined as returning blood sugar levels to non-diabetic ranges, without the aid of diabetes medications, for at least 3 months. This doesn't mean the disease is cured. It means your body is no longer in a diabetic state, thanks to lifestyle interventions like diet, exercise, and weight management. Think of it like putting the disease into a deep sleep. In contrast, type 1 diabetes is an autoimmune condition where the immune system destroys the insulin-producing beta cells in the pancreas. Currently, there is no cure or reversal method for type 1, but people with type 1 can still benefit greatly from healthy lifestyle choices. In type 2, the root problem is often insulin resistance, when your cells don't respond properly to insulin. As a result, glucose builds up in the bloodstream instead of being absorbed and used as energy. Here's where it gets exciting. Groundbreaking studies, like the DIRECT trial conducted in the UK, have shown that remission is absolutely achievable, especially if you take action early. And perhaps the most empowering part? These strategies aren't based on expensive treatments or miracle cures. They're built on sustainable, healthy lifestyle changes that benefit your entire body. Section 2. The weight connection. One of the strongest predictors of type 2 diabetes remission is weight loss, particularly the loss of visceral fat, the deep belly fat that surrounds your organs. Even modest weight loss, just 5% to 10% of your body weight, can dramatically improve your insulin sensitivity and glycemic control. For many, this is enough to bring blood sugar levels back into normal ranges. But this isn't about achieving a societal ideal weight. This is about reaching your body's personal tipping point, where insulin resistance decreases and glucose regulation improves. For some, losing just 10 to 15 pounds can make a huge difference. Others may need to lose more to see the same effect. And keep in mind, there are people at a so-called healthy weight who still have type 2 diabetes due to visceral fat. Conversely, there are those who carry extra weight and never develop diabetes. That's why a personalized approach is essential. A helpful concept to understand here is personal fat threshold, the idea that everyone has a different limit for how much fat their body can store safely. Once you exceed this threshold, fat begins to accumulate in places it shouldn't, like your liver and pancreas, interfering with insulin production and sensitivity. This is why targeted weight loss, especially around the abdomen, is such a powerful strategy for reversing diabetes. Section 3. Nutrition strategies. Nutrition is the cornerstone of any successful diabetes reversal strategy. What you eat, and how often, directly affects your blood sugar, insulin response, inflammation levels, and energy. Let's explore the most effective dietary strategies. 1. Lowering carbohydrate intake. Carbohydrates break down into glucose, so limiting them can significantly reduce blood sugar spikes. Many people find success with a moderate low-carb approach, 100-150 g/day. A very low-carb or ketogenic diet, 20-50 g/day. These diets often lead to improved insulin sensitivity, weight loss, and reduced medication needs. But the best approach is one you can sustain long-term. 2. Mediterranean diet. This diet emphasizes whole foods, olive oil, leafy greens, legumes, whole grains, lean protein, and nuts. It's less restrictive than keto but still powerful in improving metabolic health. 3. Time-restricted eating, TRE. Also known as intermittent fasting, This strategy involves eating within a specific window, like 8 hours, and fasting the rest of the day. Tiari can improve insulin sensitivity and promote fat loss without strict calorie counting. 4. Whole, unprocessed foods. Regardless of your carb level, focus on food quality. Eliminate added sugars, refined grains, and ultra-processed products. Instead, aim for fiber-rich vegetables, lean proteins, and healthy fats. 5. Monitoring your body's response. Tools like continuous glucose monitors, CGMs, or even regular finger prick testing can reveal how your unique body responds to different foods. For some, even healthy carbs like oatmeal or bananas may cause spikes. Data empowers you to personalize your nutrition plan. Remember, the best diet is one that keeps your blood sugar stable, provides essential nutrients, is culturally appropriate, fits your lifestyle. Section 4. The movement factor. Exercise doesn't just help you lose weight, it directly lowers blood sugar by increasing glucose uptake by your muscles, independent of insulin. Let's break down the 2 key types of exercise. 1. Aerobic exercise. This includes walking, swimming, cycling, or dancing. Aim for 150 minutes per week at a moderate intensity. Even brisk walking after meals can significantly reduce blood sugar spikes. 2. Resistance training. Lifting weights or using resistance bands builds muscle, which helps your body use glucose more efficiently. Just 2 or 3 sessions per week can make a big difference. But here's the encouraging part: you don't have to become a gym rat to see results. Even light activity, like stretching, housework, or gardening, counts. Try these movement hacks. Set a timer to stand or stretch every 30 minutes during sedentary work. Walk while taking phone calls. Take the stairs instead of the elevator. Park farther from store entrances. The key is consistency over intensity. Find a form of movement you enjoy, and stick with it. Section 5. Stress, sleep, and other hidden factors. Now let's talk about the silent influencers of diabetes, stress and sleep. 1. Stress. Chronic stress triggers a hormonal cascade, cortisol and adrenaline surge, causing your liver to release more glucose into the bloodstream. Over time, this increases insulin resistance. Mindfulness practices like deep breathing, yoga, prayer, meditation, or even spending time in nature can significantly lower stress and stabilize blood sugar. 2. Sleep. Lack of sleep, even one bad night, can reduce insulin sensitivity by up to 25%. If you're getting less than 7 hours per night, your body's ability to regulate glucose is impaired. Prioritize a consistent bedtime routine. No screens at least 30 minutes before sleep. Cool, dark, quiet sleep environments. Also, get screened for sleep apnea, which is common in people with type 2 diabetes and strongly associated with poor glycemic control. 3. Other factors to consider. Vitamin D deficiency is linked to insulin resistance. Magnesium supports glucose metabolism. Gut health influences inflammation and glucose control. Environmental toxins, including BPA and phthalates, may disrupt hormone balance. Section 6. Partnering with healthcare providers. You don't have to walk this road alone. A knowledgeable, supportive healthcare team can make all the difference. Look for professionals who stay current with diabetes remission research, focus on root cause lifestyle medicine, support gradual medication adjustment as your condition improves. Your team might include a primary care doctor, an endocrinologist, a registered dietitian, a diabetes educator, a mental health counselor, an exercise physiologist. Be proactive in asking questions like, how often should I test my blood sugar? What's a safe rate of weight loss? When should we reassess my medications? Are there group programs or community resources I can join? If your current provider doesn't support your goal of remission, consider seeking a second opinion. Your health journey deserves a team that believes in what's possible. Final thoughts. The power is in your hands. Reversing type 2 diabetes isn't just a dream, it's a documented, achievable goal for many people. And even if full remission isn't your outcome, every step you take toward better metabolic health is a win. You're not just managing numbers on a chart, you're taking back your life. Hit that like button. Subscribe for more life-changing health content. Share this with someone who needs hope and a roadmap. And in the comments, let us know, have you made any lifestyle changes that helped your diabetes? What strategies worked for you? Your story might inspire someone else to take the first step. Thank you so much for watching, and remember, your health is not set in stone. With the right tools and mindset, transformation is possible.